Bismillah ar-Rahman ar-Rahim, a new presentation about quality dimension. This is Dr. Muhammad Farid. The quality have a lot of dimensions, many dimensions for quality. We will discuss here in this presentation only 11 aspects of the quality, and dimensions it equals to properties or aspects or characters. The 11 aspects here we will discuss today is appropriateness, availability, competency, continuity, respect and care, preventing or early detection, time lens, safety, effectiveness, efficacy and efficiency. Those are the main 11 aspects for quality. We will discuss today them one by one, and we are going to put a keyword for each one of them. So let's start with appropriateness. So what's appropriateness? It is the degree to which the care and services provided are relevant to the individual's clinical needs. So the keyword here is the care we are producing or the services we are giving to the patients is relevant to the needs. So if it's relevant to needs, it's appropriateness. So given the current state of knowledge, this is the definition by JCO, the Joint Commission in 2003. Another definition is correct, suitable resource utilization as judged by peers, and it's equal to doing the right things. So if we are doing the right things to the patients or to the customer, this is appropriateness. So doing the right things in accordance with the purpose, it's another definition for appropriateness. We will give one example here. If the patient came for tooth extraction, he should leave our facility with extracted tooth, nothing else. So if we did what's related to the patient needs, relevant to what the patient needs, it is appropriateness. Another dimension is the availability, and the availability is equal to access to services. And the definition is the degree to which appropriate care and services are accessible and obtainable to meet and individual needs. So the keywords here is accessible or obtainable. So whenever the customer needs the service, he can access to it, he can obtain it. It's called the availability. The ease, another definition, the ease with which healthcare can be obtained in the face of financial, organizational, procedural, emotional, and cultural barriers. If we can break all those barriers and the patient or the customer can reach the services, we call it availability for the services. Example here is appointment should be available to all patients as in the facility scope of service. If you mentioned in your scope of service that you have the service and this service is available all the time, so any patient can reach it any time. Otherwise, if there is any barriers to the availability of the services, we will not call it available services. The third dimension is the competency, and the definition of competency is the practitioner's ability to produce both the health and satisfaction of the customers. If your staff are able to give the good services and they are competent, they are able to give their services that causing satisfaction for the customer, it's called the competency. Another definition is the degree to which the practitioner adheres. So the keyword here that the practitioner adheres to the professional and organizational standards for care and practice. So if any service is introduced by a practitioner and those services are adherent to standards, we would call it competency. Example, our practitioner should be trained and qualified to give the service or to do the job required by him. The fourth dimension is the continuity, and the continuity is the coordination of the needed healthcare services for the patient or specified population among all practitioners and across all involved in organizations over time. This means that there is no interruption for the services. For example, if the patient was seen by a surgeon and it's required to be seen by an orthopedic or something, it should be available for him. So there is no interruption. We wouldn't stop the service at any time. Another definition is the delivery of needed health care as a coherent. Coherent means not interrupted. there is no interruption, there is no cut, there is no stop. Coherent or unbroken succession of the services, truly managed care. This means that there is no interruptions for the services. The fifth aspect or dimension is the effectiveness. And the effectiveness is the degree to which care is provided in the correct manner, correct services to the patient, correct services, correct type, correct way of production of the services to the customer is called effectiveness. So correct manner given in the current state of knowledge to achieve the desired or projected outcome for individuals. So any services that give the desired outcome is effectiveness. The degree to which the desired outcome is reached. Whenever we reach the desired outcome, it is effectiveness. The positive results of the care delivery, any positive results are effectiveness. For example, if they told you that you will leave within 2 days after surgery, so you have to be discharged within 2 days after surgery, and the desired outcome is there. Surgery succeeded, everything is all right, and what they promised with you, it happened, and it's according to the desired effect by the practitioner and according to the state of knowledge. For example, like clinical practice guidelines or standards of what. Number 6 is the efficacy. Efficacy is the power of the procedure, treatment, services to improve healthcare, as already shown through the scientific researches or what's called evidence-based practice. So whatever we are giving to the patient or whatever we are doing, if it's according to scientific evidence-based medicines or researches, according what's written, what's the trial before, it's efficacy. Example here, the tooth should be extracted according to clinical practice guideline. A lot of people, they tried this maneuver before, and they documented it as a clinical practice guideline. If we are following those clinical practice guidelines, we are having the efficacy or efficacy services. Number 7 is efficiency. Always when you saw the word resources, this means efficiency. So the definition is the greatest benefit within the resources availability. We will give the maximum benefit for the customer with our available resources. The relationship between the outcome, which is the result, and the resources used to deliver the care, it's another definition by Jaco in 2003 for the efficiency. Relationship of the output, which is the outcome, services produced, to input. Relationship between input and output is the efficiency, and this is a definition by GCI, the second edition. The delivery of maximum number of units of health care for a given unit of health resources. Again, it's a relationship between the outcome and the resources. Example, give the right result with optimum resources. It is the efficiency. Number 8 is respect and care, which is the degree to which those providing service do so. They are giving the services with sensitivity for the individual's needs and expectations and individual differences, irrespective to the color, the race, the gender, whatever, anything related to the patient. Any patient can receive it at any time, and we have to respect the patient and caring for the patient and putting the patient in the focus or in the center. The patient would be the core of the services. All services would be around the patient. We will call it respect and care. Patients are involved in the decision, the provider's reaction to the patient needs. We will ask the patient what you like. We will give him options, and we will allow him to choose what's better for him after we explaining to him the maneuver and what's the advantage, disadvantage. We will ask him to share in us in the plan of care. This is respect of care. Example, patient share in the services, individual needs satisfied and taken in consideration. This is respect and care. Number 9, the safety, degree to which the healthcare intervention minimize risks of adverse outcome for both patients and provider. If the services are provided to the patient are safe for the practitioner and the patient, and even to the facility and patient relative, we will call it safe. So safety here, minimizing the risk. Another definition is the degree to which the organizational environment is free from hazards. So if the services are free from hazards or danger, it is safety. Again, the degree to which the risk of an intervention and risk and the care environment are reduced. So we are trying to reducing the risks of the care of the services and even the environment for a patient and other person, whatever they are, staff or visitors or contractor or whatever, including healthcare practitioner, and this is a definition by Jaco in 2003. So safety means no harm. Number 10 is time length. Time length means the degree to which the care is provided to an individual at the most beneficial time, at the good time, at the necessary time. There is no delay, there is no early introduction of the services. Again, it's the degree to which services are provided to customers in accordance with the perception of the promoteness. So there is no late, no early, no premature services, no delayed services. So that time it's timeless. And at last, the 11th dimension of quality is prevention and the early detection. The action taken to decrease the chance of getting a condition or situation. We are trying to decrease the chance of happening of something wrong to the patient. It's called prevention and the early detection. In quality, we prefer the proactive measures. We will not wait until the problem happens, then we are trying to correct or to deal with the consequences. No, we are dealing with it as a proactive before it's happening. We are anticipating risks, we are anticipating bad problems, and we are trying to avoid them. Not reacting by reactive after the problem happened, how to decrease the impact. Example here is FEMIA, failure mode and effect analysis. We would do this one for any project, for any services, new things, or modification of already existing services. We will do FEMIA, failure mode and effect analysis. We are anticipating where is the areas that failure can happen, and we will put an action plan to avoid those things from happening in the future. Thank you very much, and until we meet again, until we see each other again, Assalamu alaikum wa rahmatullahi wa barakatuh.